I'm Dr. Sharon Bober, and it's a pleasure to be here with you today. And we're going to be speaking about mental health and resilience during and after a cancer diagnosis. This is my disclosure. And let me first of all really start by saying that when we talk about mental health and when we talk about issues like resilience, I really want to acknowledge that often there's a lot that we don't talk about in terms of survivorship care and popular culture. So this is to say that some of the kind of comments that people often make to me personally, and we hear in clinic and we know is true, is that actually being finished with treatment often feels more challenging and actually feels harder in some ways than being on treatment. And people don't really talk about that. That can feel very stressful and very anxiety provoking. People often say that, everyone's talking about resilience, but what does that actually really mean? And gosh, it's really exhausting to sort of even think about that. Sometimes people notice that nobody really talks about partners and nobody really talks about how complicated it is to switch roles from going from being caregiver or somebody on the other side of sort of being a patient to sort of getting back to regular roles and responsibilities. And it's not always easy to know where to start with that. And often people are struggling around things like, not feeling great about their body and body image and self-esteem. And so, people make comments like, gosh, everyone says I look good or I look great, but I don't always feel that way. So I really want to start by acknowledging that although we talk a lot about resilience and the importance for good mental health and well-being, I think that there are a lot of dynamics and factors that go into that often don't get acknowledged. So to start with, I do want to acknowledge the consequences of treatment, which are very significant for many people. Survivors face various both physical and psychosocial or psychological consequences from not just a diagnosis, but from the many types of treatment that we bring to bear in order to deal with cancer directly. We know that side effects and late effects, that is the consequences that can come on long term, can be pretty significant, and they may be debilitating, they may be permanent. And these really include everything from body changes, body alterations, to pain, fatigue, cognitive and sleep changes, sleep impairment, sexual dysfunction, and certainly psychological experiences around distress, depression, and anxiety. We also know that all of those side effects really have an impact on our capacity to live and function day to day. So that might be work or school, that might be relationships, whether it's personal, sexual, friend relationships, and also just the ability and capacity for us to maintain our regular engagement in day-to-day activities. People really notice that often resuming kind of typical function, the way that things might have been before treatment, feels much harder, more tiring, and often not possible in the same way. So what we do know about psychological health after cancer, and certainly after, GU cancer, colorectal cancer, is that people often face real concerns that really have to do with the self, right? Whether that's, changes in mood, anxiety, psychological distress. And we can sort of think about some of those, again, sort of self-oriented changes, whether that's around sort of how we feel in our bodies, body image, self-esteem, sexual self-esteem, and just also the kind of ways in which our experience and the roles we play and the responsibilities we have, might feel different than they used to be. We also know that some of the concerns or distresses are or may well be in relationship to other people. So certainly we may worry just about our family members' well-being. We may worry if there is, for example, a genetic underpinning to some of the cancer diagnosis, that we may worry about physically, whether people might get cancer themselves or what this means for our family members. There's also just concerns about relationships. And again, how do they change? And do I have the same energy that I used to? Are dynamics different? Are the expectations different? And sometimes there are conflicts or tensions, especially when roles change or that people aren't able to do the same kind of things that they used to. I will say, from the point of view of good news, that we know that although, again, anxiety, depression, psychological distress is often very common, certainly in the context of diagnosis, in the middle of treatment, and often soon after treatment ends, that from the point of view of long-term psychological health, the data that we do have indicates that actually the prevalence of symptoms like depression, anxiety, and distress, let's say 5 years or more out from treatment and diagnosis, actually don't look fundamentally different when we compare those the prevalence rates with the general population. So that's something that we've started to really be able to study and to look at. And I would say, that is good news in the long term. But that means still that in the short term, again, in the context of treatment and soon after treatment and diagnosis, people often really do deal with significant stressors, and we really need to be able to address those directly. I will say also that I think in terms of survivorship, and what I often call that the tyranny of survivorship, or sort of the drumbeat of survivorship, is that it can also feel like a heavy load. Often we are seeing both from our doctors or from our team or in popular culture that in order to not just survive but to thrive, there are often a lot of recommendations. So whether that's about losing weight, exercise, eating well, changing our diet, making sure we have good work-life balance, and that's meditation and yoga and exercise, and not just any exercise, but weight bearing and cardio. And did I mention sleep? It can often feel not just like a lot, but it can actually feel somewhat overwhelming. I also think that in the culture that we live in, and certainly, and I mean, here in the United States and Western culture generally, there's an enormous amount of emphasis that gets put on being happy and on chasing that experience of being happy and feeling grateful all the time. And I think that actually places an enormous amount of pressure on many patients and survivors because we actually don't feel happy all the time. In fact, actually, it is very common for people to feel somewhat guilty if we don't feel always grateful or always appreciative or always able to look on the bright side. So not only do we not always feel that way, but there's often an additional burden that comes with feeling like, well, maybe I'm, not doing this well enough, or I'm supposed to be more grateful for where I am right now. And I think that in recent years, we've really seen a kind of a constant messaging around this notion of both positivity and resilience, both concepts that have real integrity, but have also at this point become problematic as well, in that if we are always pushing people to feel that they have to be positive all the time, if it's really critically important to just be resilient all the time, that really sets up, honestly, an unrealistic expectation about mental health. And I will add that survivors in particular often worry, and I hear this in clinic all the time, worry that those negative feelings that they might have can actually cause a recurrence, or worry if somebody's been told that maybe those negative feelings caused cancer to begin with, or can have other health consequences. So on top of the fact that we don't have any evidence for the fact that that's true, in fact, the evidence we have is that that's not true, there's an enormous amount of burden that comes from feeling like we are actually not being positive enough. So what that has recently been called is what we can think of as toxic positivity. I think that the point here is that when we sort of are in that mindset, this does not acknowledge people's very real experience of grief and loss, which is part of what happens when we go through cancer and we have invasive treatments and we're facing late effects and side effects that are very real. When people don't feel that those feelings even are valid, as I said, people can feel a sense of guilt, and more importantly, people can feel somewhat isolated because it's not something that we can talk about very easily, and somehow it feels as though it is shameful to even acknowledge some of those feelings. And I think that from my point of view, one of the most problematic aspects of such a kind of a cultural focus on positivity and on resilience all the time is that survivors can really feel like it is their fault that they are sort of not doing well because the attitude is the problem, right? It's not actually the fact that there may be real grief and loss around changes in sexuality or changes in body image or difficulties in social dynamics, but that somehow it's the attitude which is causing the problem. And we know that that's not true. And the fact is that kind of sort of grief and loss that goes unvalidated, and that kind of sense of guilt and burden that we're not being good enough at survivorship, actually does not do anything to actually improve our mood. So I want to talk about a couple of different ways which we can frame some of this. As it has been noted by people long before me, we do live in a culture that has this kind of hedonic approach, right? This notion that the goal should really be on positive affect, being happy, feeling cheerful, and simply not sort of going to that place of feeling negative or blue. And that is sort of one way to sort of think about it in terms of our goal, that the goal is happiness. But there really are other ways to frame what the goal is. Okay. And I want to just very specifically invite us to consider that the hedonic approach might actually not actually make the most sense, not only for cancer survivors, but for us, all of us, in that, we could also look at the idea that the goals for human beings is really to focus on growth and potential. It's really to focus on what is meaningful and what allows us to have a sense of purpose, rather than whether we are simply happy or cheerful as the metric for well-being. In particular, I want to underscore a model of human motivation, which really gives us a very kind of clear roadmap for thinking about this other approach, and that's called self-determination theory. So Ed Deci and Rich Ryan are two theorists who have been working in this area of self-determination theory now for many decades. This is really a very dynamic model of human motivation that posits that there are three very basic and very universal psychological needs that we really need to achieve optimal well-being and good mental health. Those are the experience of competence, the experience of relatedness, and the experience of autonomy. I'm going to talk a little bit about what those are in detail, because I think it's a very important framework for us to sort of think about in terms of mental health and well-being after cancer. The experience of competence, which certainly other theories have commented on as well, is the sense of being capable, is the experience of having skills, of knowing what to do when we're facing a challenge. The experience of relatedness, again, has been sort of commented on by other theoreticians before, and is really the very central need and the value of what that feeling is of belonging, of being in a relationship, of being cared for, of being understood. Very important. The last experience is really that of autonomy, what that means to have an experience which means that our behavior, what allows us to move forward in the world every day, is driven by a sense of volition. It is really driven by our own thoughts and needs and feelings that feel authentic and that really feel endorsed by ourselves, that it is not an experience that we are coming to only because we feel pressured, that we must do something, that we should do something, that we have to do something, only for reasons outside of ourselves. I know that is a relatively sort of broad brush on what that means. But I think the point here is that in contrast to many other theories of motivation, which talk about the need for skill and capability, which talk about the feeling of belonging, self-determination theory is really one of the primary and only theories that really emphasizes how important it is that we have an experience of autonomy. And I really want to underscore the fact that autonomy does not mean separation or independence, but it's really getting at the experience of self-efficacy. It's getting at that experience of self-determination, of volition, of agency, of the feeling that we are doing what we're doing because we are fully engaged in a choiceful manner. And that is a very important experience that underscores or underpins psychological well-being. So the idea is that when we really have all of those needs satisfied, it allows us not just to feel motivated, but it optimizes our behavior and our experience of well-being. And similarly, when those needs are thwarted, when those motivations feel conflicted or we feel pressured, well-being is undermined. So, thinking about this in terms of cancer survivorship, and I think any of us who've ever gone through a cancer experience, gone through treatment, and gone through invasive treatments and complicated medical experiences, we know that the context, the process of autonomy support is not always the case. Often it is the case that people feel that they are trapped or stuck or pressured into doing something that they have to do. Sometimes we do things that we don't want to do, but we don't always feel that we have a choice. And the question is, when we're facing something that we don't really want to do, the question really then becomes in that next step. How is it that we can kind of identify our experience with that thing, whether, for example, it might be exercise or diet, where on the surface it might not be something that we want to do, but they're able really to sort of examine our relationship with it. We're really able to figure out how to get curious about that experience and have an experience which, although I might not want to get up at 6 o'clock in the morning to exercise, I do want to feel stronger in my body. I recognize that the benefits allow me to feel better about myself, allow me to feel more energy. And we sort of translate that experience in such a way that it is a choice that we make rather than it only feel as that it's something that we have to do because something is pressuring us without really sort of feeling like it's endorsed by our true self. And we also know that similarly, the context can certainly either promote our experience of being skilled and feeling more competent and related, or sometimes the context does not promote that experience and sort of leaves us feeling either at a loss or not really clear like we have the skills to be able to deal with the challenges in front of us.
So I'm Sharon Bober, and coming to you live from Dana-Farber in Boston, Massachusetts. And thank you so much for listening to my talk today. Very happy to address any questions that you have. I can see that we have three so far. I think I'm going to start with the third of the three questions that I have, just because it's one that I was just talking about yesterday. Basically, the question really is after, several months or a year when folks on treatment get sort of sent out the door and told, no evidence of disease, see you in 3 months, et cetera. It's really at that time that people often feel really at a loss, and people often find themselves feeling like they're having a tough time when everybody else might be thinking, oh, that's great, you're done with active treatment, you know, have fun, enjoy life. And that the question specifically here is, would it not be possible to have a step down program so we cannot feel lost and ask ourselves, now what? And I just want to say, I really appreciate, number one, the concept of a step down program, right? I'm thinking about, for example, here at Dana-Farber, we have what's called a Facing Forward group for women who are finishing treatment with breast cancer. And that's actually, in a way, the very element that you're talking about. It's like, how do we move forward? It's very hard when you're in the middle of active treatment, often to even really be processing or thinking a whole lot about the scope of what you're going through, when you're really just trying to kind of keep your head above water and do what you have to do every day. And it is not a coincidence that often people feel at an enormous sense of loss and really a sense of distress when the kind of day-to-day active treatment ends, and people are really struggling to figure out now what. So I would say, on that note, whether there is, groups are not for everybody. Some people really appreciate, enjoy, get a lot out of support groups. Some folks feel like it is not helpful. It is actually stirs them up. And, I think this is the point that sort of going back to what I was just talking about, you have to identify what you need. But I think that it is not a coincidence that often people need more support when they are finished with active treatment. And what I would say is that whether that's meeting with a therapist individually for a few sessions, whether that is joining a support group or a support group for folks who are sort of in survivorship mode or finishing treatment, or whether that's talking with somebody in the community, whether that's talking with peers, whether that's talking with a priest or a rabbi. It doesn't matter who the person is, as much as that you have to find where you can get that support to be able to really process, I would say, the scope of what you've been through, the magnitude of what you've been through. And as I often explain to patients, it's really when you have a minute to breathe for the first time that you can often first take in the magnitude of what you've just gone through and start to kind of get some perspective, which can actually be kind of overwhelming. So, the concept of a step down program makes a lot of sense. And I really think that more and more we see that in a number of survivorship programs at sort of cancer centers. There are groups for folks moving into survivorship, or I should say into sort of off treatment mode, which doesn't mean that you're done. It just means it's a different space. And it's often a really important time to get some additional support. So I'm going to scroll back up to a couple of the other questions that have come in. One of the questions is, again, sort of not a small question. How do you keep the depression and anxiety of it all under control? And I think that this is where, paradoxically, I would say that I don't know that you can. I don't know that it is the goal to be able to sort of control all of the anxiety and all of the depression, because we often know that when we try not to feel our feelings, often what happens is that we feel them more intensively. And so what I would invite people to think about is that idea that I think the goal is to figure out what is the kind of support that you need in order to be able to move through these feelings, in order to be able to live with these feelings. I think certainly if anxiety or depression is getting in the way of day-to-day function, sometimes it can be helpful to have a psychopharmacology consult. Sometimes it can be helpful to use an anti-anxiety medication or an antidepressant. The truth is they don't always work. The truth is they're not always equally effective. We also know that all the medications in the world don't take away the stressors, right? So when we are struggling with, taking perspective and thinking about really sort of big questions and hard questions, sometimes the goal is not to not feel the feelings, but again, be able to sort of have a framework or process for how we make sense of them. And then how do we sort of move forward in a way that gives us a sense of meaning, that allows us to feel productive and allow us to feel a sense of, I hesitate to use the word control, but that we have a sense of autonomy or choice, right? That we're able to sort of make good decisions that allow us to feel like we have a sort of a driving role in our life, rather than feel like we're being sort of dragged along by wild horses. So I think that's one of the ways I would think about that question. Question specifically also is, do I have tips around helping people deal with anxiety around scans after treatment? And again, this is something that is a ubiquitous issue. Many people have heard that phrase, or that word scanxiety, right? Because we know that that's common. I again want to sort of go back to that sort of basic framework that I don't think the goal is to not have anxiety when we're having a scan, right? I think that if you think about it, anxiety is actually partly how we are hardwired. It's a very adaptive part of being human. So if we had no anxiety, we may not do our scans. We may not go for screening and do our surveillance. The key is being able to find a balance, right, between feeling the anxiety and allowing ourselves to actually sort of really identify what some of the, for example, bigger picture questions are that sort of underlie or fuel that. So obviously, I'll give an example. People sort of worry about anxiety with scans because the clear worry is that they're going to find something, and then what will happen, and then what will we do, and then what will it mean? And my invitation is really to tell people, it's normal to have the anxiety. What's helpful is to draw ourselves back into the moment, into the present. This is to say that we don't know what's going to happen with every scan over the next, hopefully, many, many years. But the question is, what can we do right now? Can we ask ourselves, what do I need right now? It's normal to have anxiety around a scan. The question is, what can I do to soothe myself? What can I do to comfort myself? So it's not so much about saying, don't be anxious, but it's more about saying, what would I do for a friend if a friend had some question about feeling anxious? You would say, what can we do to either, switch gears, soothe yourself, do something just different, give yourself a break. Maybe you need to literally sort of change things up and turn on some music or talk to a friend, take a shower, just literally distract yourself. And sometimes it's also about just talking to yourself, right? And saying, this is normal. Hey, anxiety, I know you. Have a seat, sit down. See, I've seen you before. This is an old friend or pal. I know what you do. Have a seat and, make yourself comfortable. I have some other things to do right now. So I think the main paradoxical intervention is not to try to tell yourself, don't be anxious, but to really sort of acknowledge, look, it makes sense. I'm nervous about the scan. And what do I know? What I know is that I have a good medical team. What I know is that I have people that are going to be there for me from the beginning, who are going to sort of take care of me and help me sort of figure out what my next steps are. What is my real risk right now? I might not know that, but I know that I'm going to be able to get what I need if I need something. I'm going to be able to get the help that I need to get me through this. What do I need right now to manage these feelings I'm having? Would it be helpful to talk with a friend? Would it be helpful to take a walk or just do some deep breathing? I think the point is not to be mad that we're feeling anxious, or not to be trying to push something away, as much as trying to find a way to sort of hold that, to sort of sit with that, and also be able to sort of acknowledge that we need to be able to find ways to comfort ourselves and soothe ourselves when we're feeling those feelings. Another question people ask, or somebody asked, was how do you keep patients engaged as they go through treatment, but have progression or change of disease? So I'm not sure exactly what that means in terms of engagement, but I would say that it's when people have progression, when people have change of disease, it's really important to acknowledge that, first of all, again, you may need to really sort of ask yourself, what do you need now? And that may be different than what you needed before. So that may be that you need to have a different kind of structure to your day. That may be that you need to have more support. That may be that you need to be able to speak with friends or family or a counselor or a group to be able to sort of add in more support. That may be also figuring out how you take time out from some of the other stressors in order to be able to sort of make room for taking care of yourself. I don't think that the goal here, again, is to be able to feel okay if you feel angry, or if you feel sad, or feel a sense of loss. I think the question is to be able to sort of have some strategies and skills for being able to, one, identify what you're feeling, and then when you feel what you're feeling, be able to sort of ask yourself what you need to be able to sort of hold those feelings and move forward in terms of being able to do what you need to do, whether that's work, whether that's school, whether that's family, as opposed to feeling sort of paralyzed and not really being able to sort of how to cope, because there's help for that, right? We have help to allow people to sort of gain skills, gain strategies to be able to cope with what's sort of on their plate. So I'm just going to scroll through some of these questions. Somebody said, thank you for your presentation, validating for a survivor who's out of treatment. Do you have a recommendation for how to locate a therapist? Okay, that's a very important question, especially because, and again, fully kind of owning that the world that we're living in right now, I think there is a bit of a mental health crisis in this country that goes beyond, that's probably connected to the pandemic, and that goes beyond, just this right now, right? It's about the sort of the larger context. So I would definitely recommend people check into the APOS, the American Psycho-Oncology Society. They have listings of resources in terms of how to find a provider for psychosocial support. I also think that sometimes if you go to large databases like Psychology Today, you can search on a whole bunch of parameters for a therapist, not just by state and by insurance, but specifically by kind of medical issues or cancer. And, I think it is important to try to find a therapist who has worked with cancer survivors before. So it doesn't feel like you are just, your job is only to educate them, although you may have to educate them a little bit about your particular experience. But we really do have a number of resources and societies such as the American Psycho-Oncology Society. Also, the American Cancer Society has some good resources online about how to find a therapist. I do think the good news is, well, if there's any good news from the pandemic, we also have a lot of people doing telemedicine now. You definitely are not necessarily having to only meet with somebody that you can go who's nearby, right? So if you're willing to get on Zoom and you're willing to have a telemedicine appointment, it certainly opens up a much larger geographic region where you can reach people. And again, a lot of people who are experts in psycho-oncology or have experience with medical care, medical patients, oncology related, you don't necessarily have to stay with somebody local. So I would say that's one place to start. Not sure if there are any other questions. I think that's all I'm seeing for now. I really want to, again, just sort of underscore that point that when it sort of see right here. I'm looking if there are any other questions. What do you find works best to deal with survivor's guilt? That's actually a very important question because often people feel like they are somehow, they didn't deserve to do okay when other people didn't. And that, I will say that really sort of, I think is amplified by this culture that we live in, where we talk about people being survivors and fighters and warriors. And there's often this kind of implication that somehow people aren't warriors or survivors or fighters if they die of cancer, which makes no sense at all. But that's again because of our crazy culture. That's really not because of anything that's true. So I think from that point of view, when we think about survivor's guilt, what I would really invite people as a place to start, where I would invite people to go as a place to start, would be to really want to know what's sort of behind that. What is that feels uncomfortable. I would say in general, what's important is that you recognize that all of this is a combination of many factors. That's the case for often why we may get cancer. We don't often know exactly, but we assume it may be a combination of many factors. It could be biological, but in combination with environment and other issues. And then the other piece is that, feeling guilty as a survivor, I guess what I would ask is to ask yourself, what do you get out of that? How does that serve you? I think that in many ways, when we find ourselves alive for whatever reasons, one of the most important things to do with that is to say, again, what can I do right now, right, to allow me to feel like I am giving back? That I have meaning, that I am creating meaning by doing something for others that allows me to feel a sense of being productive and a sense of sort of giving. And I would say in general, when we think about survivor's guilt, often the most important antidote to some of those feelings of why am I here and I don't know is to feel like you are doing something meaningful and productive, not just for yourself, but also for others. So I know that somebody asked about the network that I mentioned for finding a therapist. I would say that the APOS, the American Psycho-Oncology Society, if you Google APOS and cancer, it will take you to the APOS website. They have a number of of resources for how to find a therapist. Also, there are national kind of databases such as Psychology Today, which is a general, very large database that psychologists use and therapists, social workers. It is not specifically for cancer patients, but you can search for a therapist on a number of parameters, including specializations such as medical oncology. So that's another place that you can start. What would you suggest on finding a passion again? That's a great question. So, I think that finding a passion, whether it is after a cancer diagnosis or any other kind of major juncture in life, is kind of an important question. It's really about how do you figure out who you are? What is it that drives you? What is it that gives you a sense of purpose? What I would say is that, it is important to allow yourself space and time to experiment. I would say that not everybody feels a passion all the time, but what I would actually recommend people sort of think about instead of passion might be purpose, right? Finding something that allows you to feel like you are doing something that is productive and meaningful, that allows you to feel like you are making the world a better place, that you are helping other people, that you are getting outside of yourself and trying to figure out how to sort of fix a broken world in some way. I think purpose is often a more helpful focus than passion. I'm not against passion, but I think that we also live in a society where everybody's always sort of feeling like if they don't have a passion, there's something wrong with them. And I think passion often comes second to something that is skillful, right? Passion is often something that we build or cultivate out of something that we do well, out of something that feels engaging or productive. And often I think it's helpful not to start with finding one's passion, but better start with finding one's purpose. And that is really sort of driven again by a combination of something meaningful and something that is productive. So that would be how I would address that question. Just looking to see if there's anything else right now. I think those are the questions that I can find. Just looking through. I think those are all of the questions that I have for now. Okay, so if anybody has anything else that they want to quickly type out, I'm more than happy to take another minute and address those. Otherwise, I also just want to say that, please don't feel that you have to struggle alone. Know that we actually have really sort of more resources now than ever for folks that are on treatment, off treatment, kind of caregivers of folks on or off treatment, and really just acknowledging that it is not something that anyone can do alone, right? Everybody needs support. And the key here is to figure out what works for you, not to feel like you have to do something because other people are telling you to do it, but really to sort of figure out what it is that you're feeling, what it is that you're needing, and what it is that would help, what it is that you need right now, right? And to sort of create a bit of an action plan or sort of steps for you to experiment with in order to give yourself some of the support that you're needing. Again, without artificially in any way trying to pretend that you have to be happy or you have to be fine, but more to be able to really sort of sit with the feelings that you do have and feel like you can still find a way to move forward, again, feeling like you have a purpose, a plan, and feeling like you can focus on something meaningful for you. So again, I want to thank you so much for having me here with you today. I appreciate you watching my video, and feel free to be in touch through the Dana-Farber if I can be a resource at any time. Thank you.